and that Miss Lee did nothing wrong. She not only wasn't grossly negligent, she wasn't even negligent. She did exactly what a reasonable nurse practitioner would do in those circumstances. Some key points to remember that relate to Miss Lee and her defense. 3 of them. And I'd just like you to keep these in mind as we go through the case and you hear the evidence, because I think it'll help you bring into proper context Miss Lee's case and what happened that night. The first is a nurse practitioner, not a doctor. I'm not sure if you're tired of me saying that yet or not. You may be by the end of the case, but I think it's important, I think it's significant that everyone understand that Miss Lee is a nurse practitioner and not a doctor. Now, that's not to make light of or trivialize her role in this case, because she had a role to play. She had a responsibility, and it was important. But it was limited, in a sense, because she is a nurse practitioner and not a doctor. Miss Lee did not decide to discharge Miss Arnold. She didn't. When you hear the entire story, you'll hear who decided to discharge Miss Arnold. It wasn't Miss Lee. And it wasn't even Dr. Deal. Finally, and this one is really, really, really important, because I know you heard about troponins in the plaintiff's opening. No rise in troponin, no heart attack. The reason they get 2 troponins is because the first one could be minimally elevated, as it was in this case. And it might be because someone is having something going on with their heart, or it might be because they're having something going on somewhere else in their body that might be affecting their heart. Not a heart attack, but there are chronic medical conditions that can cause a minimal elevation in your troponin level. But the reason you get 2 troponins, and I'm getting ahead of myself a bit, is you want to look to see if there's a rise. Because the cardiologist, I think all the doctors we're going to bring you, but I know the cardiologist we're going to bring you, Dr. Chris Arant from Carrollton, Georgia, he will tell you that to diagnose a heart attack, you have to have a rise in the troponin. If you don't have a rise in the troponin, you're not having a heart attack. The second troponin in this case, we'll look at again in a minute, not only did it not rise, it actually went down a little bit.